Well, thank you, Aaron, again, and good afternoon, everyone. As Aaron mentioned, my name is Nathan Bodis. I'm a member of the sales team based out of Cleveland, Ohio. Today I'm going to talk to you a little bit about some of the work that we've done and that we continue to do with our friends at Meditech and McKesson. Now, whether you're looking to enhance your electronic form strategy, reduce the time and the cost associated with a paper-based consent process, or automate some of the processes Aaron mentioned in HR or materials management, like some of your Meditech and McKesson hospitals are doing today. FormFast is going to remain, your ideal partner to complement your HIS investment. So the first thing I wanted to do was just talk a little bit about our Meditech experience. You may or may not know that for over 15 years, FormFast has been a collaborative partner with Meditech, and we provide functionality that, again, enhances the investment that you've made with Meditech. As a collaborative partner, we're able to build and test the proper integration that goes along with an electronic forms strategy with each successive platform release from Meditech. From Form Central, a platform that was designed specifically for our Magic clients, to FastPrint for client server and the 6.x users, we have your form and e-signature needs covered. We're also currently testing integration with the Meditech Web Ambulatory offering so that we can get some signature capture capabilities in that as well. So for those transitioning to 6.x, I get questions quite often about what that process looks like, and is there any major software changes that need to be made, and what does that situation look like? Just want you all to know that if you are moving to the 6.x platform, we do have updates in place and services available to help you configure to your 6.x platform. At this point, in the early stages of Meditech's 6.x platform, we do have the most experience in working with that platform. It's a list that's ultimately growing every day with hospitals going live, with a number of active projects out there right now, and several more that will be coming on board here before the end of the year to start their projects. Now, altogether, we have over 500 shared Meditech clients, some of whom are utilizing FormFast outside of just forms and e-signature. So regardless of which platform of Meditech you're using, know that regardless of the IT needs that you have, we can automate you for some of your enterprise processes outside of forms and e-signature, like HR, purchasing, materials management, and even invoice processing like our friends at Fraud Log Medical Center do. So talk a little bit about the Meditech Advantage in review. We do have that tested, proven, and repeatable integration across all Meditech platforms. We have been a partner with Meditech for over 15 years. And will be for years and years to come. And we'll give you that true form strategy to ultimately augment your Meditech investment. What I'm going to do now is actually move on and talk a little bit about McKesson as well. So from a McKesson standpoint, the narrative has many similarities. Before we go into specifics, I did want to address a question that I've received multiple times over the past year when speaking with McKesson clients about the relationship between McKesson and FormFast. As you know, McKesson used to have an option to resell our eForm and e-signature solutions in their EHR implementations. Now, about a year ago, FormFast decided that it would be more advantageous for both the end users and for FormFast as a company to sell directly to McKesson clients. And, when a change like that occurs, the narrative out in the field may be misrepresentative of what's actually happening, just to cause some fear, some uncertainty, some doubt as to whether we still work with McKesson products. In short, just let me say that the integration that we built with McKesson still exists, and it still works across all the platforms, from Paragon to Horizon to Sirius to Star. The only difference is that the terms and conditions of your FormFast agreement are on a different piece of paper. We own 40% of the McKesson market share, and we have the most eForms experience out there with live clients in the marketplace, including some direct launch integration from your platforms. When we talk about some of that experience, we'll talk about the 70 facilities within the CHS umbrella that are contracted to use our e-signature software. We talk about Rideout Health, who uses our FastFlow workflow automation tool for the automation of their HR and payroll workflows, and even the entire province of Alberta, Canada, Alberta Health Services, 99 hospitals who came to FormFast and said, help us with 3 initiatives: help us to reduce our operating costs, help us decrease our environmental footprint, and help us increase our patient safety initiative. So the experience we have with McKesson is long, and we'll continue to work with McKesson hospitals as current clients and bring on any new ones that want to come join the FormFast family. So to talk a little bit about your McKesson advantage, again, 40% of McKesson clients use FormFast. They use integration that's built, that's proven, that's repeatable. We have solutions for across the enterprise. Again, eForms, e-signature, and then workflow automation with our FastFlow product. We can get mobile for e-signature for you and automate that archival process as well. So that's what I had as far as just an overview of what we're doing from a Meditech and McKesson standpoint. Aaron, I don't know what you were thinking about for questions, but if we wanted to do that now or save those for later, we can do that.
I'll actually save those to the end of this section. We'll go ahead and pass the ball to Tracy.
Okay. Well, good afternoon, all. My name is Tracy Zwallen. Actually, good morning to those of you on the West Coast. I'm a regional sales manager here for the western part of the United States. Aaron, can you see my screen okay? I just want to confirm before we dive in here.
Sure can.
Perfect. Well, before I dive into just a couple of the slides I have talking about how we've been able to help Siemens, Cerner, and Epic customers, I wanted to spend just a second on an observation that I've made over the years. I've been very fortunate to be in the healthcare industry for a number of years, and it's been a fun process. I've been able to watch as hospitals have migrated from a paper-based solution to the EHR. And it's been fun to watch the impact that the EHR has made and all the many benefits that it's brought to hospitals. It's also been fun to watch hospitals be laser focused for many years as they've integrated these EHRs and made them work within their facilities. But I've also noticed a trend over the last couple of years where now the EHR is in place and now these hospitals are wanting to take it to the next level, and they've realized that there's some gaps here and there from the EHR. And I don't say that in a negative way. I think an appropriate phrase would be, not everyone can be great at everything. There's a lot of moving parts within a hospital, and the EHR, while it offers many capabilities, there's certainly some gaps there that folks can fill. And that's really where FormFast comes into play. We're able to fill those gaps and really complement the EHR and take it to the next level. And so that's really the theme that for the next couple of minutes I want you all to think about is how FormFast is able to help hospitals really get the most bang for their buck from their EHR, especially from a clinical documentation standpoint. So moving forward here, talking a little bit about how we've helped Siemens customers. Obviously, there's a lot that we've done for these folks, but focusing on a couple of items, and as you'll see from Nate's slides that he shared before, there's a reoccurring theme here. But first off, we support all of Siemens platforms. We work closely with many of the EHRs, and we're able to offer direct launch integration, and I'll talk a little bit about that here on the next slide about what that means. But between our direct launch integration and our mobile e-signature solutions that we're able to offer Siemens customers, that really complements what they're doing today, and it does take them to the next level, and it does offer them many benefits from a caregiving standpoint, financial benefits, to name just a few. So talking more specific about some of the benefits and ways that we've helped Siemens customers. First off, like I said, we integrate directly with Siemens. And we do that with a direct integration. And what I mean by that, let me paint a picture. And I know some of you have already utilized FormFast in this scenario, but some of you may have not. For example, I was speaking with a customer last week, and she was walking me through the registration process. And today what she does, she doesn't utilize FormFast. She goes into her EHR, and she prints out some forms. Then she goes into a different system and prints out sticky labels. And then she goes into a different system from that and prints out a wristband so she can admit a patient. And I look at that process and I think, wow, with our direct integration capabilities, with one click, within that EHR, I could have accomplished all that in a matter of seconds with our fast print solution. And being able to explain that to this customer and what we can do was huge for her. Just not only how to simplify and streamline the process, but also the amount of time that I would give her back in the day was just mind-boggling to her. So those are the type of things that we're able to offer to our customers. In this example, a Siemens customer. We're able to complement all of the Siemens platforms. We're able to standardize the process for our customers. So as you know, folks travel throughout the hospital, it's that same workflow utilizing the FormFast solutions. And then taking that one step further is we're able to also offer our e-signature solutions to Siemens customers as well. And we're able to digitize those forms. Instead of printing them out, we're able to electronically sign those and immediately put those back into the EMR versus waiting for them to be scanned at a later date. And we'll dive into that a little bit further when I talk about Siemens and Cerner and Epic. But really fun to be able to watch the capabilities that we can offer to hospitals and be able to streamline their processes. Now, one thing I also wanted to mention, and this is not specific to Siemens, but this is for all EHRs, there's still transition in the industry as far as hospitals are still looking for the right EHR for them. Not every EHR is a perfect fit. And so one of the things I want you to think about is as you implement or have implemented the fast print solutions and FormFast solutions, is that workflow that we designed for you today can also be applied for you tomorrow if you switch EHRs. So that certainly helps in that transition process and makes life a little bit easier for those end users. So do keep that in mind as you may be considering changing EHRs down the road. Okay? So switching gears and talking a little bit about Cerner. Again, we support the Cerner platform. We're able to support them with that direct integration again. But really, the huge impact that we're able to make for our Cerner customers is from an e-signature standpoint with those dynamic forms, and from a mobile e-signature standpoint as well. I spent a lot of time talking to customers, and they're desperately looking for that e-signature capability, and very specifically from a mobile standpoint. So taking a little bit closer look at Epic, and then we'll dive in specific benefits. Again, looks very similar to the Cerner solution. I kind of lump Epic and Cerner together as they're the larger EHRs in the industry and have similar capabilities, but not exact. But again, we support all the platforms of Epic, Prelude, Epic Care, et cetera. We give our Epic customers that direct integration. So again, with one click within that workflow that they're used to using today, we're able to output all of their forms, all of their labels, all of their wristbands in one fell swoop with one click and no additional screens to go to. And then again, our Epic customers are very much looking forward to the capabilities of a mobile e-signature solution, and that's a solution that we can very easily give to them. So specifically, what are the benefits that we're bringing to Cerner and Epic customers? First of all, we're able to allow them to create and maintain a forms repository outside of the Cerner and Epic environment. And I'm sure some of you are thinking that some of you, if you're on Cerner and Epic, you're thinking, well, I can put forms in Cerner and Epic. But what we're able to do is we're able to create that in a very easy to manage system, and it gives you full control. And so some of you that are on Epic and Cerner, you might think, well, that process without FormFast is not very easy. We're able to give you full control. Obviously forms are very dynamic. They're changing. They require updates on a regular basis. And with the FormFast solutions, we're able to give you those tools to be able to update those forms in real time, very simply and easily. And another benefit of being able to create this forms repository outside of the EHR is we're able to offer you a downtime solution. And that downtime solution could be planned or unplanned. Things happen. Large EHRs require maintenance. Sometimes they go down. And unfortunately, patients don't care if the EHR is down. If they're sick and they need, need help. And so having a downtime solution to be able to care for those patients, regardless of the status of your EHR, is critical. And so we offer a fantastic downtime solution utilizing the FormFast capabilities. But Cerner and Epic, I think most of the time I'm talking to these customers, I'm talking about our e-signature capabilities. Right now, and I'm sure a lot of you are facing this exact same situation, scanning is out of control in hospitals. The expense, the time that it takes for forms to get back into the EHR is out of control. And so with our capabilities, our e-signature capabilities, we're able to, in the registration process, instead of clicking that one button I mentioned before and having it output to a printer, I can output that to a monitor. I can walk that patient through those forms in real time. I can check boxes if necessary right there on the form. I can free text filled right there on the form. But then when I'm ready, I can have the patient sign on a signature pad that they use in a grocery store each and every day, something that they're very comfortable with. I can have them sign that form electronically, and then immediately that form goes back into the EHR, which does two things. One, we've eliminated the need to scan that form because it stayed digital the entire process. And two, instead of waiting 24 or 48 hours for that form to be scanned back in, which a lot of my hospitals, that's what they're saying it takes, we're able to put that form immediately back into the EHR with our direct archival system and then give those caregivers immediate access to that information, which today they just don't have. So the solutions that we're able to bring to Cerner, Epic, Siemens is significant, not only from a cost-saving standpoint when you look at reducing scanning costs and getting time back to your registration folks, but also from a caregiver standpoint, you're giving instant access to your caregivers, which I think is really the world to me and to the patients in your hospitals that desperately need that care. So that's just really a quick snapshot. One of the things I would definitely recommend that you do, as Nate mentioned, we've helped many, many customers. We have over 1,000 customers. And I would highly recommend you visit our website. We've got a section on there where we've done some case studies. And it talks about a lot of the hospitals that we've helped, and a lot of these are on Cerner and Epic and many different EHRs. Take the time to look at those, because a lot of the situations that they've been in, I'm sure are very applicable to you. And I think it'd be helpful for you to see how we've been able to help them. So with that said, Aaron, we can open up for questions, and happy to answer any.
Thanks, Tracy. Go ahead and submit questions for both Nate and Tracy, but I also wanted to give Yancey a chance to share a little bit about the work that we're doing to complement administrative systems. One of the themes of today's sessions is to highlight the fact that FormFast can be used not just in the clinical environment, but throughout the enterprise. So I wanted to give Yancey a chance to share a little bit on that.
Great. Okay. See if it wants to work this time. All right. Well, it's queuing up. So it's very similar to what Nate and Tracy spoke of in the EHR world is in the administrative world as well. A lot of hospitals have very large ERP systems, such as Lawson and PeopleSoft, that they're using the HR portion or the finance portion or all of the above. Also, there are actually quite a few Meditech hospitals probably using the human resources module, Cerner. Most of the big EHRs also have administrative parts to them. And certainly, you know, straightforward functionality, they're very good at it, but they have core goals. They take care of the core things. And so there are gaps, and most of that, I mean, part of that because nowadays hospitals are being innovative and want to see how they can improve their processes to make the patient experience better or to save money here or run things more efficiently. So they want to do things a little bit differently. And that's where the FormFast solutions and our workflow automation can fit in really well. So in all those different administrative areas, HR, risk, finance, we can fit in and automate your processes and, again, make them more efficient but also more effective for a few different reasons. So first of all, the process is pretty simple. We can take any of your paper-based processes and we can make the form electronic and then design an electronic process around it that fits with your organization. So the first thing about that is it's customizable and it's flexible. Sometimes in the larger systems, you're not going to have that flexibility. So you're going to be able to tailor things to your organization because there are particular needs that you have to meet for your employees and your patients as well and other stakeholders. So also, as far as system consolidation, this is a huge benefit to our platform, is that instead of having what you see quite often, you have a finance, 2 or 3 finance applications working in that area. Then you have 2 or 3 risk and quality applications over here. And then in HR, a lot of times you'll see about 10 different applications to do all the different functions. Much more, it's much easier to manage from an IT perspective as well as an admin in those areas and end user if you can consolidate some of those systems. So with our solutions on the administrative side, you can take our workflow, create some HR workflows, then you can do finance, and then you can do risk, and all of a sudden you've connected all the systems, and it's much easier to manage. In addition, I'm sure we could all think of processes that we do cumbersome and manual that it would be great to automate, but it sure would be great to have data on as well. Because a lot of those processes, it's very hard to collect data on how long is it taking at each step in the process. How could we do this better? Are there redundancies in this process? And it's very hard to make and perform that process improvement if you don't have that data. From our system, you can collect that data and analyze it on a regular basis. So with all these processes that you put into our platform, then you can see how is the process running, which areas is it taking the longest. You have precise data to decide how to optimize that process moving forward. Very powerful tool. So in particular, we are going to talk more about the FastFlow application itself tomorrow. So I did want to put the information up there, but we'll move swiftly. And we spoke earlier about HR. We are doing a whole lot in this area right now, and you're going to hear more about that tomorrow. But very exciting, again, this area looking at we can help you make your processes more efficient, help you manage them a lot easier, and also make them better in some cases. The larger systems, again, they do core functionality. They certainly manage the data well. But if you want to do some specific different things with that data, such as the recognition piece or a comprehensive onboarding process, sometimes that's not available to you. And we can make it readily available to you. Okay? Then we did mention, so we have certainly helped a lot of organizations in this area, purchase requisitions and invoice processing, making those processes easier, cutting out some of the redundancy. Certainly, in the case of multiple approvals at different stages, different levels, depending on how much the purchase is for, we can make that much easier. The problem of paper sitting on somebody's desk that may be out of town or maybe just busy doing other things, they don't see it, it sits there for a few days. Delays like that cost. You may not see it directly sometimes, but it certainly does have a detrimental effect on your operations. So we can improve that situation and we can make it a whole lot easier for you. So certainly in the risk and quality area, it's very crucial information here, and the ability to pull that data on a regular basis and understand how those procedures are working and policies are being approved and managed, crucial to operations and compliance. So we can certainly assist you in lots of different areas. We will speak more about this tomorrow, but the important thing to remember is if you do have these larger systems, FormFast can certainly complement them and work right alongside. In fact, integrate with them. Just as we've seen, we can pull data from the EHR and put it on forms. We can do the same with your HRIS systems and things like that. So reduce the amount of double data entry and minimize your time. So that's all I have for today, and I will pass it back to Aaron for some questions.
Excellent. Yes, we'll officially open for questions at this point. I've had a few come in. First one I'll direct to whoever wants to take it. Do you work with all scripts? And I'll pass that. I'll direct that to Tracy.
Thanks, Aaron. Yeah, absolutely. We definitely work with all scripts, have a number of all scripts customers, and pretty much the answer is we work with most EHRs on the market today.
Excellent. A couple questions on switching EHR systems. First one reads, we're planning to switch EHR systems. When should we talk to FormFast about migrating our forms to the new system? And let's see, I'll direct that to either Tracy or Nate.
Yeah, hi, this is Nate. I think it's a function of, really, the timing of the project, and when you wanted to get those forms over. So the first thing I do is either call your account manager or your RSM, just explain the situation, and then we can certainly come back to you with a time frame for, dependent on how many forms you have and what sort of conversion you want to take place, you know, sort of the level of effort that that it would take to do that and the amount of time that it would take, and then we'll certainly, you know, work within the guidelines that you give us to get those forms converted over as quickly as possible and at a date that you set. Long story short, I would engage.
And I believe that Philip just provided a link to a form to contact the sales. So use that if that applies to you. Another question, I'll direct this one to Nate as well. We use Meditech Magic. Can we use e-signature with Form Central?
Yeah, there's actually a couple of ways that you can do that. We can certainly get you e-signature within Form Central, and then we can also, with our web form imprint interface, give you the ability to be a little bit more mobile if you want to work outside of Magic to take, you know, your tablets and your other mobile devices around for mobile consent signatures and then decentralized registration. So short answer is yes.
And we can see if there's any final questions. As always, if you do think of questions related to EHR systems or administrative systems, always want to hear what you're curious about. Contact us once again, formfast.com/contact. And I think that will conclude this session. I want to thank Nate and Tracy and Yancey for sharing some content on our compatibility with our systems. Thanks, guys.